And
we'll see you for episode 3.
Episode 3 next time.
Yes.
We appreciate you all being here. This is BodyPlus podcast. Move better, know better. Is that it?
No, the other way. Let's do that one again.
I tried. That was okay.
You were close.
So
you were close.
Okay. Hey, welcome to BodyPlus. I'm Dr. Zoe Fasulakis, and I'm joined today with my co-host, Dr. Oliver Sanchez.
Yes.
We're both chiropractors here in Vancouver, BC, and this is a show where we break down everything to do with your body, movement, injury, performance, and recovery, and everything in between. Whether you're dealing with something that just won't go away, trying to get more out of your training, or just want to understand how your body actually works, this is for you. We keep things real, practical, and easy to understand. No jargon, no fluff, just honest conversations and clear answers. We'll be sitting down with experts, athletes, and practitioners who are actually in it day to day, people working with these problems in real time. So whether you're new here or coming back, we're glad you're here. This is BodyPlus. Know more, move better. All right. It's episode 2.
Yes, it is.
Let's get into it.
We survived episode 1.
We survived episode 1. We're trying our best here.
Yeah.
So we're going to continue with giving a bit of insight to who both of us are. And so today we're flipping it around. And this time I'm going to be interviewing Oliver today.
Yes, my turn.
So last episode, Oliver sat down with me, and now I'm going to be interviewing him. So Oliver's a chiropractor here in Vancouver and the founder of Foundation Body Lab. He graduated from Palmer College of Chiropractic West in San Jose, California. And before that, he completed his Bachelor of Science from Simon Fraser University here. He's someone I work alongside every day, and also someone who spends a lot of time helping patients move better and understand what's actually going on with their body. So today we're shifting the focus a bit, getting into Oliver's perspective, how he thinks through cases, and what's shaped the way he practices. So Oliver, welcome to you.
Thank you. Yeah,
Awesome.
My turn now.
Now your turn.
Now
we'll
we
get
do
into it.
Okay.
So we'll start off a little bit of understanding his journey into chiro. So how did you yourself get introduced to chiropractic, and what made you decide to become a chiropractor?
Okay, so I'm actually one of the people that does have a chiropractic story. So for me, it was through football. I was playing football when I was a teenager, and I got really injured on a hit. So I got hit pretty hard, got injured my shoulder. I ended up going to my family doctor. The family doctor just basically said, you should probably quit. You're too little to be playing football, which I didn't. But
listen.
I got very lucky that somebody in my building was a chiropractor. He came across my dad, saw that I was injured, and said, hey, why don't you send Oliver in and we'll take a look at him. We'll see if we can get him feeling better. And I did. And he was basically able to get me feeling better, got me fixed. And then I was able to return to the field and get to playing again. So that's when I really kind of got interested in chiropractic at that point. It kind of came into my world. And then I've been pretty much a patient from that time on.
Yeah. Okay, yeah. So more traditional. A lot of people often get into becoming a chiropractor from their own personal hands-on experience.
Exactly, because when we were going to school, I actually found out that there's a lot of people nowadays that actually don't have a chiropractic story and have become chiropractors. Like one of my best friends from chiro school, he had never actually been to a chiro.
Yeah.
He just looked it up, found out that it was a great career, and he became a chiropractor.
Yeah.
Yeah.
Good story though.
Yeah, exactly.
So you also were a personal trainer.
I was, yes.
And so that experience working with others, how did that kind of teach you a little bit about working with injuries, working with people?
Well, yeah, we were very lucky to work with a very athletic population. They did a lot of activities. So we trained a lot of people for marathons, Ironman. So we got to learn how to manage injuries along the way because a lot of people were getting injured quite regularly. So we were basically, we were able to help them recover, go through the rehab process, and go through the progressions that they needed to get back to their activity.
And I feel like that probably has helped a lot too with just day to day with patients.
Absolutely, because it translates right over to what we're doing every day, just at a different level, basically.
Different level, yeah, and you're great with kind of like recovery and exercise prescription and all that sort of stuff too.
Absolutely.
So while you were at Palmer West, you worked at a lot of events, right?
Yes,
I
a
think
lot of sporting events.
A lot of sporting events. I think there's the Sea Otter Classic.
Yes.
San Fran Marathon was one.
Yep.
An endurance challenge. So lots of like in-person experience there.
Absolutely.
What did you see at those events?
So those events, we saw a lot of different things. So we saw everything from just basic sprained ankles, hamstring strains, that sort of thing, to pretty severe injuries. We even had people go into cardiac arrest that we had to help with as well. Because at a lot of these events, we were chiro and also medical at the same time.
Okay.
So then we had help in different capacities, which was, very, very interesting.
Yeah.
So we got to see a lot of things.
A lot.
I think one of the most interesting stories that I have from that is we were at the Sea Otter Classic, and we had someone that had fallen on a training run before the event on a mountain bike, and they actually split their finger in half.
Whoa.
So like straight down the middle. I had never seen it before. It almost looked like a knife cut right through it. So yeah, so this person, we bandaged them up, told them they have to go to the hospital immediately. And so off they went. They told us they didn't need an ambulance, so they took off. A couple hours later, we saw them back in the medical tent. And we're like, what are you doing here? They're like, oh, I thought I was still going to be able to compete. And at this point, he was having some blood loss. So we ended up having to put him in an ambulance and send him on his way.
That point.
Yeah. So interesting stuff. A lot of good things that you see in these events. So you get a lot of experience, dealing with all sorts of things.
All different injuries. Yeah. That's great. So when you were at Palmer as well, you graduated Magna cum laude. So that's like a pretty good academic graduation thing. So was academic excellence something that you've always strived for? Or is that something that just came naturally?
I think it developed.
Okay.
Yes, I don't think it came naturally because I wasn't the best at undergrad. I was okay. I had a decent GPA, but not the best. But while I was in undergrad, I actually encountered a professor of mine that was for biology, and he basically told me, Oliver, whenever you find what you're passionate about and that you really like, you're going to work really hard at it and you're going to do well with it. And that's what I found when I went to chiro school. I just really enjoyed it. I loved everything about it. So I really, took it serious, studied a lot. And I guess that's what came with that was the result.
The result, yeah. I think that's true though. When you're passionate about something, usually the work ethic goes towards it.
Exactly.
And then you usually do well. So okay. So now that we've got to know a little bit about your history and getting into being a chiropractor, we'll talk a little bit more about you being a chiropractor in the day-to-day.
Okay.
So you've been practicing since 2011?
Yes, long time now. 15 years.
15 years, yeah, that's wild. So looking back, how do you feel like your relationship is with work? Is it still fresh, or do you feel like work has evolved? Talk about that.
I think it's still pretty fresh. Enjoy coming in, which is really nice. It's definitely evolved over the years for sure, much different. So a lot of different things have come up in the research, a lot of new changes to how we approach treatment. So I would definitely say there's been quite a different approach from when I first started. But yeah, it continues to be fresh that way because there's always new things to learn. And I enjoy going to continuing education, learning as much as I can, coming back. So it's really good.
Yeah, definitely, I guess, evolution, right? With the changes in sort of what they
from where you start, where you start in school till now, it definitely changes over time.
Which is good to stay up to date on that too.
Yes.
So you use a variety of stuff in your treatments as well.
Yes,
so
I do.
Spinal manipulative therapy, so adjustments, cold laser, shockwave, Graston. So you have a pretty big toolkit.
Yes.
When do you know what to reach for?
It just depends, I guess, on the patient. Okay. So like we talked about last time, that you're, evidence-based. As am I. So we're basically looking at what the patient is looking to get out of the treatments, our experience, and at this point I have a decent amount of experience, and then what the latest research is telling us is, what's a good approach to do that. With that, it also depends on, what stage of the condition they're in, if it's fairly acute or it's been a little bit more chronic, we're going to change the way we approach it. And then what type of condition it is, if it's a shoulder, back, knee, ankle, because with both of us being sports chiros, we see a lot of different things. It's not just one type of condition. We're not just back doctors all the time. No. We do see necks and backs regularly. Yes, we do. Yes. But we also see, fingers, toes, just about anything.
Yeah, everything really. And that does change things, right? So it keeps things fresh too. And that's why you're not doing the same stuff always all the time.
Absolutely.
So you're also a strong believer in patient education too.
Absolutely.
Why is that such an important part for you?
I think that ties into, letting the patient know exactly what's going on. What I find a lot of times that I've seen over my years is that they've seen other therapists in the past, and basically they never get a clear diagnosis. So for me, educating them on what I think is going on and how we can approach it and get them feeling better is very important. That way, the outcome will probably be much better. So yeah, letting them know what's happening, what we're going to do, and then what steps we're going to go through to get to that point. Whether that's what's going to happen in treatment, how we're going to progress those, and then into their rehab and how we're going to approach that.
Yeah, I think that's important to note on too, is diagnosing. That is something that we as chiropractors are allowed to do in our scope that not every healthcare person can do.
Absolutely.
Right?
Yeah.
And that's really big. And then help with guiding with stuff too.
Yeah.
So you get a new patient that walks in.
Yes.
First time seeing them. What's something that you look for right away with that new person?
Well, we actually look at everything.
Okay.
Because as you know, as chiropractors, we're known to be the backwards walkers here at the clinic. So we're often walking backwards, and people are actually surprised that we do that. But the main reason we do that is to see what's going on. We want to look at you as soon as you get up from the chair. How are you moving? Do we see any aches and pains, that sort of thing? And then we want to see your gait as you're coming into the clinic or into the office. We want to see, is there any change? What's moving? Is there right knee? A lot of times people are surprised, oh, how do you know my left knee's hurting? I'm like, well, we can see it.
Yeah, I visually can see.
I can visually see it because we're walking backwards, taking a look at it, seeing what's going on. And then the one thing that I've kind of seen over the years is definitely looking at people's faces. You'd be surprised how much you can learn by looking at them. You can see, if they're in pain, definitely seeing, if they're fatigued, if something's going on. So that's really nice that you're able to see that. So yeah, we're basically looking at it all.
At it all, yeah.
Yes, and that's even before we get you in here to do the exam.
Yeah, I was going to say, it's not even just in the room.
Yes.
It's literally from front office, front desk,
all the way
walking
through.
in. Yeah, it starts from hello.
From the beginning.
Yeah.
Yeah.
Yeah, so everything. So, like you mentioned, you like to define yourself as a sports chiro.
Yes.
So seeing a lot of sport performance, athletic people. That can be active people, so from your weekend warriors to a high out level athlete, right?
Yeah.
With those different types of active people, do you treat them differently?
I would probably say no. I think I treat everybody very much the same. And then depending on what they need, we're going to give them very similar treatments to most actually high-level athletes a lot of the time. So people are often surprised that, they'll come in, even if it's, something minor, and you're going to get, potentially some cold laser therapy on it. You're going to get some joint work, and then also some taping as well. Yeah. I tell them all, I'm like, oh, you're officially an athlete now, which they really enjoy, and it helps out. But that's going to be very similar to the same way we're going to treat most high level athletes or anybody that's quite active from the general population. But it's going to be very similar. Yeah.
When someone gets injured,
yes,
but they still want to be active, or how do you navigate that, I guess I should say?
That's always a tough one.
Yeah.
How do we navigate it? I think so. Basically, for me, I try to keep people moving as much as I possibly can, regardless of the condition. We all know that basically moving it is going to help to some degree. But again, you can't push it to the point where you're aggravating the condition.
No.
So you definitely want to keep it within reasonable means, keep them moving as much as you can. So that means whether we're just doing modifications on their regular activities, whether that's loads, or intensities, that's going to be one of the big ones. Or if we can just get them doing some light mobility work, that's going to be the key thing. Whatever keeps them going, keeps them moving, until we can get them better and they can start to increase their intensity and loads back to where they were prior to the injury.
Yeah, no bed rest.
No bed rest. No bed rest.
No bed rest.
No, we're off of that.
So when you're seeing someone who's trying to get back to running or training, or return to sport after their injury, what does that process look like from your side?
To getting them back to activity. So a lot of the times we're going to be basically continuing to treat them, but at the same time we're going to be slowly progressing them through some exercises, some whatever they need. If it's a runner, we're going to start off very slow. We have to modify some of their distances and intensities because runners love to really push it with that. So we have to reel them in, tell them if we want to get back to where we were prior to the injury, we definitely have to build up slowly, get back to the regular routine, and let the body adapt to the loads that they're going to be taking, the pounding that's going to come with increased mileage. So yeah, just slowly progressing everybody through, and again modifying as as well. So if we got, a weightlifter, we got to modify the loads, modify the types of exercises that they're doing until their body can tolerate, the original movements.
Yeah. I feel like too, with the personal training background, you're probably like very familiar with that sort of process too, right?
Yes.
Very comfortable with
guiding people through.
Yeah. Modifications, knowing that as well.
Yeah.
Let's transition into clinic ownership and understanding a bit of that, a little snippet into it. So firstly, like what made you decide that you wanted to open a clinic?
Well, for me, I've always wanted to be a clinic owner.
Okay.
So ever since I was going to school, I've always decided that I wanted to be a clinic owner. But knowing that in Vancouver, it's extremely difficult just due to the high cost of everything. So for me, it was definitely a much longer journey than some of my friends that I studied with in the US. So it definitely took some time, but I was always definitely wanting to get my own clinic eventually. So it took me 9.5 years before we were able to open up Foundation Body Lab. But yeah, it's been great ever since. Yeah, it's been a good experience. Lots of learning. Made a lot of mistakes along the way. Yeah. So,
like with anything, that's normal too.
Yeah, there's growing within that as well. Yeah. So with practice, there's growing, and then
like the other side of it too. I know you go through the growing pains of starting early career and then later on career stuff. There's always learning.
There's always learning. It never ends.
Yeah, never ending. What was the hardest part in those like early days, would you say, of starting up Foundation Body Lab?
The toughest part was actually finding practitioners here in the city.
Okay, interesting.
Yeah, even though I think we're in a very good location here on Main Street, it was just hard finding first good people, because we wanted people that kind of fit our kind of clinic style and what we were trying to accomplish here. So it was very difficult doing that. And then just, getting people to come, because starting off as a new clinic, people were scared that they might be a bit slower here starting off. It might take some time to build practice, but as everybody knows, it always takes time to build practice. It doesn't
matter where
you go. It's going to take some time. So I think that was kind of the most interesting thing that we encountered, was finding practitioners and good practitioners to come join us. It was a bit difficult, but then luckily we found you, so that was good.
I guess so far.
It worked out.
Just one of many.
Just one of many, for sure.
Yeah. So one thing here at Foundation Body Lab, we have chiropractic, like you and I. We have massage, acupuncturists, and naturopathy as well. Yes. So a lot of things under one roof. Yes. How did that sort of vision come together for you?
Well, we always knew that we wanted to have a multidisciplinary clinic. With my wife being a massage therapist, it kind of made it much easier that way. So, having massage, chiro already there, we always knew we wanted to incorporate some other healthcare therapies and modalities that we can bring into the clinic. We've been lucky enough to find some really good people, for acupuncture and all the other therapies that we offer.
Yeah, everyone here is great.
Yeah.
So you've been open for a few years now. When did you open again?
So we opened in 2019. Yeah, so this will be our 7th year coming up in June.
Yeah, that's crazy.
Officially. Yeah, probably it's gone by really fast. But it's been great. Yeah. It's been a journey.
I think that's always a good word.
Yes.
But so now like 7 years in, looking back, is there anything that stands out you maybe approached differently?
We made a lot of mistakes.
So that's normal.
I think we did a pretty good job setting most things up when we first started. But there were, a few small things that we could have probably done a bit better. But I think we did pretty good overall. But I think for the most part, pretty good.
I feel like there's always going to be like unknowns that you can't even 100%. Prepare for regardless, and you have to learn on the way, but
it just kind of happens as you go.
Yeah, but I feel like from my perspective, it's been pretty smooth.
Yeah, we try. We do our best. We make it look better than the background. Things are happening, but
it's clinic ownership for everyone.
Yes,
there you go.
Exactly.
Okay, let's get into the rapid fire start, or part of this, I should say. So first thing, what's something people tend to overcomplicate when it comes to their health? Recovery. Health or recovery.
Exercises.
Exercise, okay.
Yes, they seem to overcomplicate the exercises. So a lot of people want to do whatever trend they're seeing on TikTok, on Instagram, that sort of thing. And sometimes going simple is the best way to go. So I think that's one of the things I see people overcomplicating quite regularly. Sometimes just getting back to the basics is the best way to go, and then you can kind of progress from there. But you don't need to be jumping on a Swiss ball or doing flips off bars and all sorts of things to get back to 100%. Yeah.
That's a good one, actually.
Yeah.
I agree. What's something you've changed your mind on since you've started practicing?
Changed my mind on? Well, I think for me, being a chiropractor, I always wanted to adjust everybody. I really enjoy adjusting. I think it's a fantastic thing to get, to move things, get people feeling better that way. But I've definitely learned that there's times where you don't always need to adjust things, and there's other things that you can do to get things feeling better. And especially if they're very acute, sometimes it's best to, just wait for that to settle down before you start pushing on things.
Yeah.
Yeah.
Totally.
Yeah.
What's something small that people can do that will actually help them move the needle?
Movement.
Everything's movement and exercise.
Exercise, basically. Yes, movement and exercise. Yeah, just little increments every day can make a huge difference. As we now know, even like 30 minutes of just walking can be quite effective for a lot of people. So just getting out there moving is going to make a big difference. So that's going to be the key.
Like you said, like even with the exercise thing, simplicity, right?
Simplicity, nice and
It doesn't
easy.
need to be overcomplicated, honestly, then.
No.
So last one. What is your gym cringe?
Oh, I didn't want to get into this one last time. So, the biggest gym cringe. Well, I don't go to the gym as much as I used to, like the regular gyms anymore. I mainly train at home, but probably say the grunting.
Like noises, grunting.
Noises, grunting, yeah. Yeah,
Sometimes
I've
it's
had
a
some
little
interesting experiences with people grunting at the gym. It gets a little wild.
Something a little obnoxious, maybe,
Yeah.
and just
And I think some of the gyms actually say like no grunting.
Yeah,
like,
they
have
have
a signs and stuff. But
quiet zone.
yeah, I would probably be in the quiet zone if I go back to the standard gym.
Yeah, I would agree with that. The grunting's a big one too.
Yeah, I'm good with that.
All right.
All right.
So that's a wrap for episode 2.
Finished up.
We finished up. We survived again.
Yes.
But hopefully for all those listening, that gave you a bit of insight to who Oliver is, how he approaches his care with his patients, and what he's seeing day to day in clinic, and even a little bit into clinic ownership a bit.
Yes.
All right. So next time will be episode number 3.
Number 3.
And we'll stay tuned for what that's going to be about. Leave it as a little surprise. Thank you all for being here. We appreciate it.
Yes, absolutely.
This is BodyPlus. Know more, move better. Have a good one.
Have a good one.